Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. In the previous different videos lecture, we talked about the blood smear. We talked about anisocytosis, poikilocytosis, variation in in RBC, and we talked different cell structure, each and everything in detail. That is really important for you when you are examining the blood smear. Now today in this video lecture, we are going to see basic comments in the blood smear which we are mostly given. Okay, so there are different basic comments. Okay, a lot of basic comments we mostly give in a routine cases. So let me show that the first too much important basic comments that we are going to give in RBC in a blood picture. So this is about the normochromic normocytic blood picture. We mostly give this comments in blood smear when we see the blood smear. Remember, when you are looking the blood smear, you have to RBC report, or you have to the RBC not RBC, you have to the blood picture, complete blood picture report. When you have a complete blood picture report, then you must see the blood smear. So the first comment that we usually give, we call that normochromic normocytic blood picture. Sometimes we also call that normocytic normochromic blood picture. What does it mean? It means that in a field, if you see that the cells are normal in size and they have normal color, means they have normal HB, due to which the cell are normal in color and normal in size, we call that normochromic normocytic blood picture. If you see the MHC value, MCH value, the value are normal, and the MCV, mean cell volume, the value are also MCV is normal, then we call that normochromic normocytic blood picture. Next comment is normochromic normocytic blood picture with leukocytosis, leukocytopenia, thrombocytosis, thrombocytopenia. I didn't write here, but when you see that the RBC are normal in size and normal in shape, and they have normal color, and they have leukocytes in a large number or leukocytes in a low number, so then we give the comment like in this way. Third, we have normochromic normocytic anemia. What does it mean? It means that the cells are normal in size and color are normal, but the cells, RBC cells, are low in number. It means when you see in the complete blood picture report, if you see RBC level are low, so then this is called as anemia. One thing more, that HB level are also low, it also indicates the anemia. Normochromic microcytic blood picture. What does it mean? It means that the blood have normal color, but the blood size are small. How you will identify that the blood size are small? You will see the value of MCV. When the MCV value are low, like low than 80 femtoliter, then it will be the microcytic blood picture. And you see that the RBC color is also normal, so then we call this normochromic microcytic blood picture. Another comment, we have normochromic macrocytic blood picture with thrombocytopenia, thrombocytosis, and so on. Sometimes we have leukocytosis, leukocytopenia. So this is normochromic macrocytic blood picture about. When you see that the HB, RBC are value are okay, but the MCV value are low, and the RBC value are also low, so then this is called as normochromic microcytic anemia. It means that the RBC are small in size, RBC color are normal, but the RBC level are also low, so then this condition is called as normochromic microcytic anemia. When you see in the microscopic field that the RBC are large in shape and they have normal color, and how you will identify in the blood picture, in the blood picture report, when you see that the MCV value is high and the HB and RBC value is normal, but the MCV value get high, so it means that this comment is called as a normochromic macrocytic blood picture. Next comments, we have normochromic macrocytic blood picture with thrombocytopenia, thrombocytosis, etc. When you see, let's suppose in the blood picture report, when you see that the cell are HB are normal, but the MCV value get high, okay, and it is also the platelet value are also get low. Sometimes platelet value are high, so we call that normochromic macrocytic blood picture with thrombocytopenia, thrombocytosis. Okay, so this is another comment, sir. Next comment of the normochromic is about normochromic macrocytic anemia. So in normochromic macrocytic anemia means that although the blood are large in size, but the large blood size RBC are low in number. We have large blood RBC, but they have low in number. We call that normochromic macrocytic anemia. And in this case, in the blood picture, you will see that the RBC shapes, you will see that MCV value is high and the rest of the value is normal. So, and RBC value are also low. So this is called as normochromic macrocytic anemia. So this is about the normochromic related comments. In the next video, I will explain the hypochromic and then hyperchromic related comments. Okay, I hope this video is helpful for you. Thank you so much for watching.